Hi, I'm Liz Tassone. I'm the volunteer host of Caring Matters, the Caregivers Assistance podcast, Assistance Network podcast. And I want to talk to you today about an article I read a couple of months ago called Caregiving's Hidden Benefits. It was by Paula Spann, and I found it on the internet. And what's so amazing about this article is I've been doing the work in the particular field of caregiving. I started out many years ago in 1998 working for a radio program called Family Caregiver Hour. And so at that time I really delved into the field of caregiving and family caregiving specifically. And a lot of the news about caregiving in those times when I was doing the interviewing was not all that good. There was a higher level of stress, and we talked about some of the burdens, and there's a lot of joys in caregiving too. But there were no studies that were showing that this indeed was actually good for you. So I was really surprised when I read this article about caregiving's hidden benefits, and it's a research study that was done. So forgive me that I'm going to be reading a lot of this, but I really want to share this news with you because I think it's incredible news, and I just want to say, yay, go caregivers when I read this. So it says, could there be measurable benefits to your health or to your brain in particular from being a caregiver? It's practically become an article of faith that the reverse is true, that caring for an elderly relative is so stressful, relentless, and draining that it takes a toll from your well-being. Well, some studies have even shown that it increases your risk of depression and heart disease, impairs your immune system, or even contributes to your death. So these are the things that we've read about for years about caregiving. So that caregiving could actually provide some health advantage is so counterintuitive that when Lisa Fredman, a Boston University epidemiologist, she first saw results emerging from her study of elderly women, she thought, what on earth is going on here? I blame myself. I thought something was wrong with my data. So she started getting that caregiving was actually had a positive effect on people's health, so she could hardly believe her data, and she thought she was doing something wrong. But over several years of studying the differences between caregivers and non-caregivers in 4 locations, she was in Baltimore, Pittsburgh, Minneapolis, and Portland, Oregon, Dr. Fredman and her colleagues found that while caregivers were indeed more stressed, they still had lower mortality rates than non-caregivers over an 8-year study. So she was just astounded by this. And then in another study of about 900 women, and it was drawn from those same 4 cities in the US, that even those classified as high-intensity caregivers, because they performed more functions for the dependent relatives, they maintained stronger physical performance than non-caregivers. So on tests like walking pace, grip strength, speed at which they could rise from a chair, the high-intensity group, the high-intensity caregivers, declined less than the lower-intensity caregivers or the non-caregivers over a 2-year period. This was a shocker, Dr. Fredman said. So now Dr. Fredman and her co-author by the name of Rosanna Bertrand, who is a health policy associate at ABT Associates in Massachusetts, they've gone back to the pool of women to look at their cognitive functioning. So what was showing up is that the caregivers were stronger physically, but now they're asking the question, how are they doing cognitively? How is the stress of caregiving on their memory? So here again, caregivers did significantly better on memory tests than did non-caregivers following a 2-year study. So though the groups were about the same average age, in the early to mid-80s, caregivers scored at the level of people who were 10 years younger. Good news. Yay, caregivers. So along with what's called caregiver burden, which we've all heard about, it's all the stress related to caregiving, gerontologists and psychologists use the phrase caregiver gain to reflect the fact that this role, which often exacts such high costs, can bring rewards. But they've typically described those rewards in psychological, emotional, or even spiritual terms, such as growing confidence in one's abilities, feelings of personal satisfaction, increased family closeness. These were some of the things that people identified as a benefit to caregiving. And now they're saying that caregivers can walk faster and recall more words on a memory test. And that's the big news, that there's actually some physical and memory benefits to being a caregiver. So Dr. Fredman's begun referring to the notion that caregivers are not invariably beaten down by their responsibility as something called the healthy caregiver hypothesis. So taken together, Dr. Fredman's studies provide evidence that caregivers, however stressed, may be stronger and stay stronger than women of the same ages who don't undertake those tasks. So now the interesting question is why? So I'm reading now from this article done by Paula Spann, so I don't want you to think I'm writing all this. This is something that was in her article. It says you cannot randomize studies like this, assigning some old women to serve as caregivers and not others. So it's likely that part of the differences is that Dr. Fredman said stem from self-selection, that women become caregivers because they're healthy enough to shoulder that responsibility. So if you're not healthy, that task may go to your daughter or daughter-in-law. It's not surprising, therefore, that even high-intensity caregivers have and maintain more physical strength. And this is just a side note, but a friend of mine who was a caregiver, when she learned that her husband was diagnosed with Alzheimer's disease, she began lifting weights because she knew as his disease progressed, she would need to begin lifting. And so she continued that well into her 80s, that she was lifting weights in order to be a good caregiver and knowing that it was going to be a physically demanding job as well. So I just want to say that it's great. I thank Paula Spann for writing her article on caregiving's hidden benefits. It's great news. It's something to celebrate. And we know that caregiving is a hard job, and we know that it can be very stressful at times, but there's also some good news here today, and I just wanted to point that out. So congratulations, caregivers. And before I close, I just want to thank our sponsors that are part of sponsoring this podcast, and that's Vitas Hospice, Hillebrand Home Health, Home Care by Blackstone, Family Bridges Home Care, Lifespan, and Bailey. So thank you to our sponsors. They'll be glad to know we've got lots of good news today to share on the Caring Matters podcast. I'm Liz Tassone, and always remember that caring matters.